Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. This is 15 practice NCLEX questions. Without delay, let's get started.
An elderly client was prescribed Ativan 1 milligram 3 times a day to help calm her anxiety after her husband's death. The next day, the client calls her daughter asking when she is picking her up to go to the graveside. The client says she's been walking up and down the driveway for the past hour, waiting for her daughter. Noting the client's agitation, hyperactivity, and insistence, the daughter calls a nurse to report her mother's behavior. Which of the following would the nurse suspect as the cause of the mother's behavior? And what action would she suggest? 1. The client is manic and may need a sleeping pill. 2. The client is experiencing a medication interaction and should go to the emergency department. 3. The client is experiencing a paradoxical reaction to Ativan and should stop the new medication immediately. 4. The client is overcome by grief and probably needs an antidepressant. The correct answer is 3. Paradoxical responses to benzodiazepines are more common in children and the elderly than other age groups and generally occur at the beginning of treatment. Grief/depression in the elderly is more likely to result in fatigue and withdrawal than hyperactivity and agitation. Treatment with a sleeping medication, chemically related to benzodiazepines, is likely to result in an increase rather than decrease in agitation symptoms in elderly clients. A medication interaction is possible, but less likely since most pharmacies screen for drug interactions when filling prescriptions. An elderly woman experiences short-term memory problems and occasional disorientation a few weeks after her husband's death. She also is not sleeping, has urinary frequency and burning, and sees rats in the kitchen. The home care nurse calls a woman's primary health care provider to discuss the client's situation and background, assess, and give recommendations. The nurse concludes that the woman, 1. is experiencing the onset of Alzheimer's disease. 2. is having trouble adjusting to living alone without her husband. 3. is having delayed grieving related to her Alzheimer's disease. 4. is experiencing delirium and a urinary tract infection. The correct answer is 4. Delirium is commonly due to a medical condition, such as a UTI in the elderly. Delirium often involves memory problems, disorientation, and hallucinations. It develops rather quickly. There is not enough data to suggest Alzheimer's disease, especially given the quick onset of symptoms. Delayed grieving and adjusting to being alone are unlikely to cause hallucinations. The stigma related to having a mental illness, especially a chronic illness, persists despite improvements in the management of illnesses and an increase in public education. Which of the following views most perpetuates the stigma? 1. Mental illness is hereditary. 2. Mental illnesses have biochemical bases. 3. Clients cannot prevent mental illness if they want to do so. 4. Clients can recover from mental illness if they have willpower. The correct answer is 4. Many still believe that recovery from mental illness is a matter of willpower. For example, pull yourself up by your bootstraps or just get over it. This belief persists despite awareness that mental illness is hereditary and has a biochemical basis. Mental illness can be prevented only if there is early intervention. Clients cannot prevent it just by the desire to do so. The most common reason given by mentally ill clients for noncompliance with medications is their uncomfortable adverse effects. When teaching the families, what needs should the nurse identify as the greatest? 1. Alternative ways to manage the adverse effects. 2. Home visits to set up a week's supply of medications. 3. Family monitoring of the administration of medication. 4. Outpatient monitoring of medication compliance. The correct answer is 1. Ways to decrease or manage adverse effects without additional medications is crucial. Although home visits, family monitoring, and outpatient monitoring may help, if the adverse effects are not controlled, the client is less likely to take the drug, which would interfere with its effectiveness. Crisis intervention plays a major role in the management of care for clients with chronic mental illnesses. Although the safety of the client and others is always a priority, these clients typically need crisis intervention. In which of the following situations? Select all that apply. 1. Inability to keep outpatient appointments. 2. Signs of relapse and decompensation. 3. Threat of eviction from housing. 4. Unpaid bills and lack of food. 5. Occasionally missing a dose of medication. The correct answers are 2, 3, and 4. Although all of the situations require immediate attention, the inability to keep outpatient appointments is less critical than signs of relapse and decompensation, threat of eviction, and unpaid bills and lack of food. Occasionally missing a dose of medication usually will not precipitate a crisis for a client. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. Before placing the fetal monitoring device on a prima gravida client's fundus, the nurse performs Leopold's maneuvers. When performing the third maneuver, the nurse explains that this maneuver is done for which of the following reasons. 1. To determine whether the fetal presenting part is engaged. 2. To locate the fetal cephalic prominence. 3. To distinguish between a breech and a cephalic presentation. 4. To locate the position of the fetal arms and legs. The correct answer is 1. Leopold maneuvers are performed to determine the presentation and position of the fetus. The third maneuver determines whether the fetal presenting part is engaged in the maternal pelvis. The first maneuver distinguishes between a breech and a cephalic presentation through palpation of the top of the fundus. The second maneuver locates the fetal back, arms, and legs. The fetal heart rate monitoring device should be placed near the fetal skull and back for optimal fetal heart rate monitoring. The fourth maneuver is done to locate the fetal cephalic prominence if the fetus is in cephalic position. The nurse assesses a primiparous client with ruptured membranes in labor for 20 hours. The nurse identifies late decelerations on the monitor and initiates standard procedures for the labor client with this wave pattern. Which interventions should the nurse perform? Select all that apply. 1. Administering oxygen via mask to the client. 2. Questioning the client about the effectiveness of pain relief. 3. Placing the client on her side. 4. Readjusting the monitor to a more comfortable position. 5. Applying an internal fetal monitor. The correct answers are 1, 3, and 5. Decelerations alert the nurse that the fetus is experiencing decreased blood flow from the placenta. Administering oxygen will increase tissue perfusion. Placing the mother on her side will increase placental perfusion and decrease cord compression. Using an internal fetal monitor would help in identifying a possible underlying cause of the decelerations, such as metabolic acidosis. Assessing for pain relief and readjusting the monitor would have no effect on correcting the late decelerations. Assessment of a prima gravida client reveals cervical dilation at 8 centimeters and complete effacement. The client has severe back pain during this phase of labor. The nurse explains that the client's severe back pain is most likely caused by the fetal occiput being in a position that is identified as which of the following? 1. Breech. 2. Transverse. 3. Posterior. 4. Anterior. The correct answer is 3. When a client has severe back pain during labor, the fetus is most likely in an occipito-posterior position. This means that the fetal head presses against the client's sacrum, causing marked discomfort during contractions. These sensations may be so intense that the client requests medication for relief of the back pain rather than contractions. Breech presentation and transverse lie are usually known prior to 8 centimeters dilation, and a cesarean section is performed. Fetal occiput anterior position does not increase the pain felt during labor. The nurse is caring for a prima gravida client in active labor who has had 2 fetal blood samplings to check for fetal hypoxia. The nurse determines that the fetus is showing signs of acidosis when the scalp blood pH is below which of the following? 1. 7.5. 2. 7.4. 3. 7.3. 4. 7.2. The correct answer is 4. If the fetus is hypoxic, the pH will fall below 7.2 and be indicative of fetal distress. This finding typically requires immediate vaginal or cesarean birth. A scalp pH reading of 7.21 to 7.25 should be repeated again in 30 minutes for assessment of hypoxia and acidosis. The primary healthcare provider prescribes scalp stimulation of the fetal head for a prima gravida client in active labor. When explaining to the client about this procedure, which of the following would the nurse include as a purpose? 1. Assessment of the fetal hematocrit level. 2. Increase in the strength of the contractions. 3. Increase in the fetal heart rate and variability. 4. Assessment of fetal position. The correct answer is 3. Fetal scalp stimulation is commonly prescribed when there is decreased fetal heart rate variability. Pressure is applied with the fingers to the fetal scalp through the dilated cervix. This should cause a tactile response in the fetus and increase the fetal heart rate and variability. However, if the fetus is in distress and becoming acidotic, fetal heart rate acceleration will not occur. The fetal hematocrit level can be measured by fetal blood sampling. Scalp stimulation does not increase the strength of the contractions. However, it can increase fetal heart rate and variability. Fetal position is assessed by identifying skull landmarks during a vaginal examination. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A prima gravida client in active labor has had no anesthesia. The client's cervix is 7 centimeters dilated, and she is starting to feel considerable discomfort during contractions. The nurse should instruct the client to change from slow chest breathing to which of the following? 1. Rapid, shallow chest breathing. 2. Deep chest breathing. 3. Rapid pant-blow breathing. 4. Slow abdominal breathing. The correct answer is 1. The psychoprophylaxis method of childbirth suggests using slow chest breathing until it becomes ineffective during labor contractions, then switching to shallow chest breathing, mostly at the sternum, during the peak of a contraction. The rate is 50 to 70 breaths per minute. Deep chest breathing is appropriate for the early phase of labor, in which the client exhibits less frequent contractions. When transition nears, a rapid pant-blow pattern of breathing is used. Slow abdominal breathing is very difficult for clients in labor. A prima gravida client whose cervix is 7 centimeters dilated with a fetus at 0 station and in a left occipital-posterior position requests pain relief for severe back pain. The nurse should 1. Provide firm pressure to the client's sacral area. 2. Prepare the client for a cesarean birth. 3. Prepare the client for a precipitate birth. 4. Maintain the client in a left sideline position. The correct answer is 1. The client who has back pain during labor experiences marked discomfort because the fetus is in an LOP position. This pain is much greater than when the fetus is in the anterior position because the fetal head impinges on the sacrum in the course of rotating to the anterior position. Application of firm pressure to the sacral area can help alleviate the pain. Problems of severe back pain during labor do not typically require a cesarean birth. The primary healthcare provider may elect to do an episiotomy, but it is not necessarily required. It is unlikely that a prima gravida client with a fetus in an LOP position will have a precipitous birth. Rather, labor is usually more prolonged. A hands and knees position or a right sideline position may help to rotate the fetal head and thus alleviate some of the back pain. For the past 8 hours, a 20-year-old prima gravida client in active labor with intact membranes has been experiencing regular contractions. The fetal heart rate is 136 BPM with good variability. After determining that the client is still in the latent phase of labor, the nurse should observe the client for 1. Exhaustion. 2. Chills and fever. 3. Fluid overload. 4. Meconium-stained fluid. The correct answer is 1. The normal length of the latent stage of labor in a prima gravida client is 6 hours. If the client is having prolonged labor, the nurse should monitor the client for signs of exhaustion as well as dehydration. Hypotonic contractions, which are painful but ineffective, may be occurring. Oxytocin augmentation may be necessary. Chills and fever are manifestations of an infection and are not associated with prolonged latent phase of labor. Fluid overload can occur from rapid infusion of intravenous fluids administered if the client is experiencing hemorrhage or shock. It is not associated with prolonged latent phase. The client's membranes are intact, so it would be difficult to assess meconium staining of the fluid. Meconium-stained fluid is associated with fetal distress, and this fetus appears to be in a healthy state, as evidenced by a fetal heart rate within normal range and good variability. The cervix of a prima gravida client in active labor who received epidural anesthesia 4 hours ago is now completely dilated, and the client is ready to begin pushing. Before the client begins to push, the nurse should assess 1. Fetal heart rate variability. 2. Cervical dilation again. 3. Status of membranes. 4. Bladder status. The correct answer is 4. The bladder status should be monitored throughout the labor process, but especially before the client begins pushing. A full bladder can impede the progress of labor and slow fetal descent because she has had an epidural anesthetic. It is most likely that the client is receiving intravenous fluids, contributing to a full bladder. The client also does not feel the urge to void because of the anesthetic. Although it is important to monitor membrane status and fetal heart rate variability throughout labor, this does not affect the client's ability to push. There is no need to recheck cervical dilation because increasing the frequency of examinations can increase the client's risk for infection. The nurse explains to a newly admitted prima gravida client in active labor that, according to the gate control theory of pain, a closed gate means that the client should experience which of the following? 1. No pain. 2. Sharp pain. 3. Light pain. 4. Moderate pain. The correct answer is 1. According to the gate control theory of pain, a closed gate means that the client should feel no pain. The gate control theory of pain refers to the gate control mechanisms in the substantia gelatinosa that are capable of halting an impulse at the level of the spinal cord, so the impulse is never perceived at the brain level as pain. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.